Hello everyone, I'm Shaquanda and I will be informing you on kidney failure. There are two different types of kidney failure, acute and chronic. To monitor kidney failure, the doctor monitors lab values and also can do a renal ultrasound. The doctor monitors your BUN, your creatinine, and also your glomerular filtration rate, also known as your GFR. In renal failure, your GFR decreases while your BUN and creatinine increases. Acute renal failure can occur simply by medications and not enough fluid intake. And to correct that, the doctor usually gives you fluids through your IV or also stop the medication that you're currently taking that could possibly put you in renal failure. Chronic renal failure is very different than acute renal failure. With chronic, there are 5 stages. Once you reach stage 5, you will have to start dialysis. Hemodialysis is also needed sometimes with acute to jumpstart the kidneys. With dialysis, there are 2 different types, hemo and peritoneal. With peritoneal, an access is made through the umbilical and is usually done at home. With hemo, there are 3 different types of accesses you can have. A catheter, which consists of either a tymp or a tunnel, a fistula, or a graft are the other 2 accesses. A fistula is when a vein and artery is directly connected to one another, and a graft is when a man-made tube connects a vein and an artery. Usually a graft is done when a patient has weak vein and arteries and cannot get a fistula. A tunnel cap is usually used for long term when a patient fistula has not yet matured. You can't get a fistula today and then use it tomorrow. A fistula has to mature, which can take from 2 to 6 months. When a patient is on dialysis, the blood is simply filtered. It's a man-made machine that acts as a kidney. It just filters the blood. It's a continuous filtration thing. Blood goes in and comes right back out. Each day, lab value can be looked at to see if a patient needs a certain dialysate. That is a fluid that's used to dialyze a patient with. If your potassium is low or your phos, they can replace it while you're in dialysis. Dialysis is usually done on a weekly schedule, Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday, for 4 hours at a time. Some patients have a hard time with hemodialysis, become very weak and sick, and cannot tolerate it. And sometimes then hospice is consulted if they're at that very end stage. And that's up to the patient and the family to decide. Hemodialysis and peritoneal are very hard to do, and it takes a lot of education and a lot of work from the patient and the doctor and the family. It takes support because when you're on hemodialysis, you have to be brought to a clinic 3 days a week if your insurance does not pay for transportation. Now, everyone is up to it, and renal failure can be prevented if done in a timely manner and followed up with as prescribed. Always monitor. Anytime you're feeling sick, feeling weak, not feeling yourself, always go to the doctor because prevention is always the best cure for any disease and diagnosis. Always pay attention to your body, drink plenty of fluids, and monitor all your lab work as scheduled by the doctor when you're discharged from a hospital, because sometimes that's when it usually occurs, when you don't follow up afterwards. I thank y'all for listening, and that's my summary on renal failure.